When we think of brain surgery, we typically think of highly specialized machines or large and expensive equipment that is used to map out tons of parts of the brain that are not immediately visible to us. But what we might not think of is the Incan Empire. But despite the two subjects seeming to be unrelated, there are tons of advancements in the Andean civilization that gave way to the modern brain surgeries we still practice around the world today. While most cultures practiced and had some form of brain surgery, the Incans stand out for their cleanliness and precision of the procedure. They were so skilled, in fact, that you surprisingly would have been more likely to survive a brain surgery performed in ancient South America than in medieval Europe. But with the intro out of the way, let's get into the mysteries of Incan brain surgery. The Incan Empire, one of the most advanced civilizations of pre-Columbian America, was renowned for its architectural, agricultural, and medical advancements. Trepanation, or the surgical removal of a portion of the skull, was performed for various medical reasons, including head trauma, pain relief, and possibly ritualistic purposes. The Incas not only refined its practice, but also achieved remarkable success rates that surpassed those of European surgeons centuries later. But now let's actually explore the origins, techniques, and the evolution of Incan brain surgery, highlighting what made it so unique and how it developed over time. As stated before, trepanation dates back thousands of years and has been practiced by numerous ancient civilizations, including the Egyptians, Greeks, and of course, early Mesoamericans. However, it was the Incas who perfected this surgical practice among all the others. Archaeological evidence suggests that trepanation in the Andes region predates the Incan Empire by at least a millennium. The earliest known trepanated skulls in South America date back to 400 BCE, with the practice continuing well on into the Incan period. This supposed date of 400 BCE would mean that the native South American peoples of the Andes had been practicing this type of brain surgery for over 1,800 years before the Incan Empire ever even started. The reasons for performing trepanation in the Incan Empire remain debated among scholars, but many archaeologists believe it was primarily used to treat head injuries sustained in battle. Like many other civilizations, the Incas engaged in frequent warfare, and blunt force trauma to the skull was a very common injury. Trepanation may have been employed to relieve pressure from hematomas, infections, or other complications caused by skull fractures. Some researchers also suggest that trepanation had spiritualistic or ritualistic significance, possibly as a means of relieving mental ailments or connect with divine forces. This practice would align with other civilizations around the world which also practiced trepanation, but for the belief that opening up a small hole in the brain would allow the gods to better connect with people into their minds. But there's not much evidence supporting that this was the reason for the Incans practicing the surgery, more so that it could have been an add-on that the Incans also believed in. The Incan surgeons developed highly sophisticated methods for performing this type of surgery. Unlike European trepanners of the Middle Ages, who often used drills or saws that caused excessive bleeding and infections, most of these patients in medieval Europe died due to these infections, leading to a very low success rate. The Incas employed meticulous techniques that minimized trauma. They primarily used scraping and tiny chisels to remove pieces of the skull. While yes, this did mean that the procedure took a very, very long time, especially comparative to those in Europe, but it did ensure that a gradual and controlled process could help the patient survive the trauma. Incan surgical tools that have been recovered were often crafted from obsidian, bronze, or other sharp stones, providing a very fine precision into the procedure. The selection of these tools highlights the Incas' advanced understanding of different materials and their properties. Obsidian, for example, was incredibly sharp and effective at cutting without causing severe fractures. If regular stones or metals had been used, bits and pieces could have been lodged into the patient's head or brain and unable to be removed, something that the Incans were very aware of and strayed away from on purpose. Archaeological studies of trepanated skulls indicate that the Incans prioritized patient survival and post-operative care. Many skulls show signs of bone regrowth around the surgical openings, indicating that the patients lived for years after the procedure. Remarkably, survival rates of the Incan trepanation reached nearly 80% at its height, far surpassing the success rates of trepanation performed during the American Civil War in the 19th century, which had mortality rates exceeding 50% and usually averaged around 54%. As the Incan Empire expanded, so did its medical knowledge and surgical techniques. Over time, the practice of trepanation became more refined, with variations in technique emerging based on geographic locations and available resources of the conquered lands. As discussed, before the rise of the Incan Empire, trepanation was practiced by earlier Andean cultures, such as the Paracas and Nazca peoples. Early trepanation techniques from these people involved crude drilling or cutting methods, which often led to high mortality rates. The early trepanation techniques employed by these people often used drilling or cutting methods, which often led to high mortality rates due to infection and excessive bleeding of the patient. However, these early cultures laid the foundation for the later advancements in cranial surgery. During the Wari Civilization, which was from 600 to 1100 CE, surgical techniques saw their biggest expansion and became much more sophisticated. The use of scraping and chiseling techniques became more common practice, reducing the risk of brain damage. Wari surgeons also experimented with different hole sizes, shapes, and different materials, suggesting an improved understanding of cranial anatomy. By the time of the Incan Empire, the practice had evolved into a highly specialized medical procedure that needed to be studied in order to be practiced. No regular Incan could perform the procedure, and only Incan doctors who studied and dedicated their lives in these schools could perform it. Unlike European surgeons, who relied heavily on alcohol or rudimentary anesthetics, Incan healers used natural pain derived from coca leaves and other medical plants. The native coca leaves contained alkaloids that provided mild anesthesia and pain relief, thus reducing the discomfort of the procedure. The Incas also incorporated antiseptic techniques, using herbal medicines with antimicrobial properties. Some researchers speculate that they used substances like saponin-rich plants, which could have helped prevent infections after surgery. In fact, it even seems that many of these doctors became very close with their patients after the procedure, and often cared for them even more. The Incan practice of trepanation represents one of the most remarkable achievements of ancient medicine. Despite the eventual fall of the Incan Empire due to Spanish conquest, their medical knowledge did not disappear entirely. Most aspects of their surgical practices later influenced Andean medical practices that ended up in Europe for centuries. The Incan practice of trepanation doesn't only just affect this region, but it represents a remarkable achievement of ancient medicine. Today, modern neurosurgeons acknowledge the ingenuity of Incan trepanation. While contemporary brain surgeries use much more advanced tools and imaging technologies, the fundamental principles of relieving cranial pressure and ensuring patient survival remain the same. Recent archaeological studies continue to uncover new insights about this medical practice, reinforcing the sophistication of their civilization. The success of their trepanation techniques, combined with their deep understanding of medical plants native to their area, highlights the advanced nature of Incan healthcare and its enduring legacy of the history of medicine. Their approach to trepanation was not only advanced for its time, but also demonstrates a remarkable understanding of human anatomy, hygiene, and post-operative care. As new discoveries shed light on their medical practices, the Incas still remain a testament of their brilliance of ancient civilization. Their legacy serves as a reminder that innovative medical techniques can emerge from unexpected places, challenging our perspectives on ancient people and inspiring future researchers to look for more knowledge. If you enjoyed this video, then consider giving this video a like and maybe even subscribing to the channel. We're a small team behind this channel, and we really appreciate any and all support that you give to us. With all that being said though, thank you for watching.